Dr. Christopher Bromley, who is a podiatrist, and he practices in New York.
This is what it looks like. So if you look at the images, you'll see here one of my patients. This is a diabetic with a Charcot. They've got a breakdown. You see a little green dot. For those of you that don't know CarePICS, when we take a picture, the green dot is the reference. It measures 1.9 centimeters, and the calculation of the wound measurement is done automatically off of this photograph. So we take a picture, circle the wound with our finger. That creates the measurements you'll see on the right side where it says chart. And then, in addition to these measurements, which have revolutionized the way that I document, we can also track the wound. We know that wounds get better, sometimes they get worse. What we're doing with CarePICS is we're trending the wound, and you can see on the bottom right the trend of how this wound is doing. And this represents what a typical diabetic will go through. They'll get better, they'll get worse, they'll get better, they'll get worse. But what we're trying to do with CarePICS is elevate the level of care. So when you see something like this, when you see a wound not getting better or a wound getting worse with that big spike, we can then use the consult feature to communicate with each other.
Right.
On the first visit, I should have been sending the patient to you for evaluation.
Right.
Maybe you did a revascularization, you send me the images back, but if I see a spike like this, this is a warning sign. It's very, very easy to see. This is a patient where I send this patient back to you and say, hey, Dr. Raja, what do you think about this? This is what the wound looked like. You can see all the pictures. You and I are looking at all the same images. We're looking at these trends, and someone like Lorie can help facilitate that, but that's a patient we need to have another look at. So
another thing is that you can have objectively, you can see that comparing the wound, is it better or worse? In my practice, one of the issues is that once we know a podiatrist or wound care physician thinks the wound is not better, by the time I see them and arrange for revascularization, it might be a week or maybe longer because the communication didn't happen.
Right.
I think this is, this should have been done a long time ago.
Yeah.
Why didn't anybody think of that? But I'm glad somebody did.
Yeah.
You guys did.
Yeah.
So it definitely helps to get the care to the patient as quickly as possible.
Right, it's that connective tissue between you and I, and our teams are now connected. We're in different offices.
Right.
We can be in different parts of the state, but because we're all looking at the same images and the same objective data, we can make good judgment and good decisions about how we want to manage this patient, and we can work together as a team. And that's what's going to give us the outcomes and save lives and save limbs.